So the current state of health quality air pollution research has been very exciting, actually. It's an exciting time to be in this field. We've made a lot of strides in the last 10 to 20 years in understanding the relationship between air pollution and air quality that people are exposed to and various dimensions of their health. Whether that's respiratory health, which is what I'm focused in, or other health outcomes that we're concerned about in children and adults. There's still a lot to do, unfortunately, despite the advances that we've made. We're trying to focus our efforts in a number of different areas. Number one is to get better exposure estimates in terms of how one's individual exposure to air pollution might vary. We have a very good understanding of global air pollution and exposure within certain cities. But our task now is to really understand at the individual level what are the activities that we're involved in and where we are in a geographical location that could influence the dose, if you will, of pollutants. And then, the challenge then is to take that information and be able to present it to the individual in a real-time fashion so that they're aware of the exposures that they're facing. Another exciting area about air quality research is to understand what are the individual susceptibility factors or resilience factors, if you will. We know that certain things about people's health, whether it's other disease conditions, their diet, and other factors can make somebody more vulnerable to the effects of air pollution in a way that two people who are exposed to the same level of toxins will have a very different response. And so trying to understand what makes somebody particularly vulnerable or trying to understand what could make them more strong against the effects of air pollution is vital if we're going to make progress in terms of interventions, things that we can tell people to do to protect themselves against air pollution. In relation to other public health concerns, air quality research is one of those things that unfortunately affects everybody because it is so ubiquitous. Air pollution, unfortunately, can span the length of someone's lifetime, all the way from when they are in the uterus to young childhood, to adulthood, even to the elderly. And in contrast to some of the other public health concerns that we have, people often feel that they are vulnerable to these effects without much control over how much exposure they get, because air pollution is everywhere. So, in contrast to something like obesity or smoking, where people feel that they might be able to help mitigate or minimize their exposure, air pollution is unfortunately everywhere. And this has a number of different systemic effects. As I mentioned, it can affect not only the respiratory system because we're breathing in the pollution, but we know that air pollution can have downstream effects on the heart, on the neurocognitive axis, and in general development of children as they get older. And so although I'm a little biased, I do feel that having strong interventions and a strong research base and understanding the effects of air pollution can have more global applicability to everybody's health in our communities.